Join us in just under a minute and a half to meet Josephine Bome. I'll be together with Charlotte Mbu to speak with Josephine, who is from Bome, Kenya, working a district nurse, working at the county level, and she'll be sharing how she has been going about, what her efforts have been together with her colleagues to ensure health worker safety while delivering immunization services. And a warm welcome to Promise Izuogo from Nigeria. Izuogo, we're pleased to have you here. We haven't announced or promoted this, so we're really looking to our most faithful and reliable Facebook fans. So please share with groups of any fellow colleagues or health workers who might be interested in Josephine's story. It's an amazing story, and we're looking forward, very honored to have her with us. See you in a few seconds. Warm welcome to you. I'm Reda Sadki from the Geneva Learning Foundation, here with Charlotte Mbu. Hello, Charlotte, and welcome.
Hi, Reda. Thank you. And good afternoon, evening, morning to everyone that's joining us on today's live bulletin.
Wonderful. And really, we're here to invite you to share and celebrate the collective effort of health workers who are working every day to protect children from vaccine-preventable diseases. Actually, very pleased to have with us Josephine Mutai from Kenya. She is a district-level nurse, but Charlotte is going to tell us more about her.
All right. Thank you, Reda. And I want to also join my voice to that of Reda to say warm welcome to you, Josephine Mutai, and thank you for accepting our invitation. So Josephine Mutai works with the Bome County Health Department in Kenya, and she is the immunization service coordinator. So she is also a member of the COVID-19 peer hub, and she took part in the just ended exercise one of the peer hub, in which she joined others to share ideas and develop a project that she will implement to face a particular challenge within a context as far as immunization services is concerned. So I don't really want to let the cat out of the bag and release everything. I really want Josephine to get to tell us the details herself, Reda.
Great. And before we hear from Josephine, I just want to share with you. So we looked up in Google Maps, where is Bome, Kenya? I have not yet had the pleasure of visiting. So I'd like to ask Josephine, as a manner of introduction, could you tell us what is your favorite thing about living in Bome County, Kenya?
Hello?
Yes, Josephine. Please introduce yourself and tell us, what do you especially enjoy about living in Bome County?
Thanks, Ida. Yeah, my name is Josephine Mutai. I live and work in Bomet County. It's a county that is situated in the western parts of the country, the former Rift Valley province. And the good thing about Bomet, it's home for me. And we just border one of the tourist attraction site that has wildlife called Masai Mara. We have a lot of visitors visiting, and there is a lot of wonder, a lot of wildlife to look at, and just wonders, beautiful beauty, nature.
Wow.
Thank you, Josephine. It's good. Before we talk about the pandemic, before we talk about the work you've been doing, it's nice to get a feel for where you live. I want to also greet Francis Ibama from Nigeria, who has joined us. Mercy Onu Peters says hello, everyone, and well done. Keep the good work going. Yes, indeed, we are striving to keep going, and it is the efforts of the more than 3,900 participants in the COVID-19 Peer Hub that we are honoring today, and specifically to hear Josephine Moutai's amazing story. Maya Soubelge as well, who says hello, and please tell us what city and country you are from, so we can properly recognize your participation. All right, so now Charlotte has selected and invited Josephine. I know that, Josephine, your project is about a critical question. How do you ensure health worker safety, your own safety, the safety of your colleagues, while delivering immunization services in the face of the pandemic? So Charlotte, over to you to begin asking questions from Josephine to understand her story.
All right, thank you very much, Reda. Josephine, I just want to find out from you, why did you choose to address this specific challenge? Because in the hub, we discovered most scholars, the challenge was the drop in the demand, that is increasing demand for immunization services. Why did you decide to choose this particular challenge, health worker safety?
Thank you, Charlotte. As I mentioned in my introductory part of the project, the first case of coronavirus pandemic, COVID-19, was announced in our country in March, but our county was free until May, when we got our first case on the 12th of May. And since then, we didn't have many figures, but then somewhere in July, the figures increased, and then of concern was the number of healthcare workers. There were quite a number, higher than other counties or higher than even the national. The infection rate of health workers was higher, and I thought it's good to tackle it before it goes too far, because when the healthcare workers are infected, first they will be put in isolation, their contacts will be quarantined, and it will affect immunization services. Because one of the things that the health facilities do is the plan. If the pandemic increases, if the numbers increase, what do they plan to do about the non-essential services?
All right, so Josephine, we noticed that the number of health workers that were infected got a little bit high in your context. What was the impact on immunization services because of that?
There was a slight drop, but so far we didn't have any stop. We didn't have any services disrupted, but we thought of bringing it to a halt or stopping it so that it will not affect the services.
Okay, thank you very much. And I want to ask now about, so you noticed this, was it before joining the Peer Hub or after joining, and how has the Peer Hub made you to change differently as far as this challenge is concerned?
I know that this just before joining the Peer Hub. So the Peer Hub has helped me because I've gone to the IDEAS engine. I've read other people who have had the issues with the same. I've read their experiences, what they are doing, and I've been able to learn from what they have done.
Okay, thank you. I hear you have talked about the IDEAS engine, and if for those who may be listening who are not part of the Peer Hub, the IDEAS engine was this platform in which scholars had the opportunity to come and share their day-to-day ideas, innovative ideas, little ideas on what they are doing differently to overcome the challenges they are facing within the context of COVID-19 to continue immunization service delivery. And in a period of 2 weeks, we got over 1,200 ideas from members of the hub from all over the world. So Josephine, if you can just tell 2 or 3 things that you retained from the IDEAS engine.
In the ideas engine, my idea first was on creating demand, an activity which we implemented in March when the first case was reported in the country. So I shared that in the ideas engine about what we did to create demand, because the attendance was, we had noted a reduced attendance. And after implementing for a number of weeks, we saw improvement. So this challenge of healthcare worker safety came in, and I thought of taking it in my project. So I was able to go through ideas engine and search for those ideas. The scholars were shared similar experiences on ensuring healthcare worker safety, and I was able to take a leave and I learned from them, and I also hope to implement some. I've included some in my action plan, which I plan to implement.
Okay, and talking about your action plan, can you just tell us, summarize with us concretely 3 actions that you're going to be taking in order to see that this challenge is overcome and that you attain your objective of maintaining health worker safety within your county?
One of the actions is to set up triage stations in health facilities that didn't have. We did facility readiness assessment, and we found that some of the health facilities didn't have stations to screen patients. So it's one of the activities that we are going to do to ensure that each health facility has a triage station to be able to screen patients and caregivers as they enter the facility. The other action is to do capacity building of healthcare workers, to retrain and mentor and on-job training on IPC practices, best practices in IPC that will ensure that they are safe as they offer the services. Then another action is to rearrange the child welfare clinics to allow for physical and social distancing, so that we ensure that there are hand hygiene facilities and that the space is adequate for clients to observe and caregivers to observe social distance. And also encourage healthcare workers to put on the appropriate PPE, especially face mask, when they are offering the services. Yeah.
Okay,
Over.
yeah. If I want to ask you another question, because I know that access to PPE can be an issue, it requires additional resources. So how are you going to get the resources to ensure that you are able to carry out these actions?
I've used a multimodal approach. Like I also coordinate nursing services, and I am in the team for the commodity security. So we've done quantification for the PPEs. We've encouraged the healthcare workers at their level to quantify what they use appropriately and then give us the requirements. And then we also place orders in a timely manner and ensure that they are distributed to the point of use.
And if I were to ask you this question, since you noticed this and you started implementing some, because I believe you have already actually started implementing some of these actions, what is the situation right now? The infection rate among health workers in your county?
There has been a reduction in the infection rate. I may not have the data for the remaining weeks, but in my project, the last week I reported, I had data that is the week ending from 10 to 16th of August. The total number of infections were 94 and 23 healthcare workers were infected. And then for the previous week, there were a total of 4 infections and no healthcare worker, none of them was healthcare workers. And I've just listened to today's briefing, the daily national briefing. Our county had 1 case and it's not a healthcare worker. So definitely we are seeing results, reduced infections generally, and also for the healthcare workers.
All right. Thank you very much. And before I'll ask Reda to see if there are any questions that are coming up on Facebook, I have just one last question for you, Josephine. And I thank you for really taking out time to accept to come and share your experience with us today. So my last question is, if there is something that has changed, that you would do differently in your workplace as far as responding to COVID-19 is concerned and ensuring immunization services continue. If there's something you're going to do that is different from now hence because of your participation in the peer hub, what will that be?
This peer hub experience has taught me to focus and to prioritize. In my first project, I had listed around 10 or 12 activities, but my peers, when they reviewed, they told me, no, this is too much and you may not be able to do. So I've learned to prioritize and look for actions that will give results and that are actionable, that are within my capacity, my capability to implement within a given time. So it's teaching me to be more focused, and I'm learning a lot from my peers.
All right. Thank you very much, Josephine. Over to you, Reda.
Great. Thank you very much indeed, Josephine and Charlotte, for such great questions. So we have a few hellos on the Facebook page. We haven't seen any questions, even though I know this question that Josephine Mutai has been working on, of how do you ensure health workers' safety as you deliver immunization services. So we looking at these issues is quite important. I would like to ask you, Josephine, at what point in your work, can you recall the moment when you realized that this pandemic was going to pose grave challenges for immunization staff? Do you recall when? Was it listening to the news or reading the newspaper or looking at information online or speaking with colleagues? Can you tell us about that moment when you realized how momentous this pandemic was likely to be for immunization staff?
I can say that I realized actually it was midway in our peer hub experience when we received the total number of cases in our county were 21 and 12 were healthcare workers from one hospital, the main hospital. So I realized that if we just leave it like that, it may get out of hand. We had to move swiftly and take actions to cover or to prevent the further spread amongst the healthcare workers.
And I have one final question for me is, even though, so we know that you're short on time. We know that immunization staff are under pressure to make up for lost coverage, to catch up, to help families and children catch up on their vaccinations, restart campaigns, and so on. So are you intending to continue contributing to the work of the COVID-19 Peer Hub? And if so, what makes it worth the time for you to put in above and beyond your regular job to be doing this collaboration with people from Kenya, but also from other countries, and to persist through this collaboration to do better to keep vaccination going during the pandemic? What is driving your motivation to participate in the Peer Hub?
Now, what has motivated me is that the peer hub activities that were required of us are not outside our daily work. It's part of what we do on a daily basis. So it's easy or it's possible to combine the peer hub activities with your work. It even makes me accountable, like what I put in my action plan. I'll be looking at it and making sure that I have done, and I'll also be learning. We have country groups here. We also have the Telegram for the other peers. So I'm able to get encouraged when I read experiences of others and get to learn a lot. We know COVID is new. There are a lot of things yet to be known, and a lot of things are evolving. So it's good to be in touch with a group like Peer Hub, where we can share experiences and learn together.
Great. Thank you, Josephine Mutai from Bomay County, Kenya. We're honored to have you with us, and I want to highlight this message from Mercy Onu Peters, who says, "Great and helpful presentation, Josephine. Thank you for implementing your actions." We also have Efyong Udobong from Nigeria joining us. Remember to tell us what city, as well as the country, and a fellow nurse colleague, Nurse Badamasi from Kano, Nigeria, who is here with us as well. These bulletins, we keep them short because we know you're short on time. We know how demanding the job of working in immunization, of reaching children to ensure they have all of the vaccines that they need. That is the top priority, whether or not there is a pandemic. So thank you, Charlotte, for leading this wonderful interview and for inviting Josephine Mutai to our daily COVID-19 IDEAS Bulletin. The idea is for participants to share their experience and to share in practice how you have been adapting to the pandemic. This, we hope you find useful. If it is, please let us know. Vote with your thumbs up or your hearts, or leave us comments in the comments and reactions. This bulletin is taking place 3 times a week, Tuesday, Wednesday, Thursday, this week. And then we'll be resuming a little bit later, so don't miss it. Keep an eye on our Facebook page to make sure you don't miss any of these great learning moments. Thank you once again, Charlotte and Josephine. Back to you, Charlotte, to close this bulletin.
Thank you very much, Reda, and I want to thank Josephine for being our guest today, and I want to thank all those who have taken part in this session and are leaving comments on Facebook. So all those who are watching us on Facebook, thank you for being with us today. And I'm really looking forward to another bulletin, and that's tomorrow at the same time, 4 p.m. Geneva time. We'll be having another guest. That will be a surprise. So do not miss it. And please, you can also share the links, share the recordings with others in your platforms, that they will join and get a hands-on feel on what immunization professionals are doing in their various contexts, from the health facility level right to the national level. Until then, I also want to thank you, Reda, for being here. And thanks to everyone. Looking forward to seeing you tomorrow. Bye for now.
Thank you so much, Charlotte. Wishing everyone well. I hope your workday is going well. I'm glad for those of you who are able to take a pause and join us to hear Josephine Mutai's story from Kenya. Glad you were able to join us. Take care.